AFMC is really known.
And also make sure
Welcome to this edition of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Stephanie Bennett, who is a community health worker supervisor, and Fernando Murillo, who's a healthcare specialist for AFMC. Thank you guys so much for joining us. So you've been doing some really great work. Tell me what you've been doing for AFMC and for the state of Arkansas.
So we started a grant with UAMS that we want to combat vaccine hesitancy. We started last April, and really to target those rural communities and the Marshallese, African American, and Hispanic communities that are a little bit more hesitant to receive the vaccine and just needed a little bit of extra knowledge and encouragement. And so we are working with them through the community health workers.
And Fernando, you've worked in the community and been really invested. Tell me a little bit about that.
Well, me as a Hispanic, I was targeting, helping the Hispanic community. So I was able actually to get some help from the Consulate of Mexico, Mexican Consulate. And because that's a good place where we can see a lot of Hispanics going, not only from Pulaski County, but from all over Arkansas and other states.
And we're saying consistently had events there pretty much every week, really, since the contract started?
Yeah, we've been having vaccine clinics every other week.
That's great. So how did this initiative start?
It started with the need to vaccinate our country during this pandemic, and there were so many just questions and misinformation out there, and so we knew that we needed to provide a trusted source in the communities to talk to people and to educate. And so community health workers really are a familiar face, a trusted person in the community. So our community health workers work in the counties that they live in, and they go to different areas to start that conversation. And then that leads to vaccine clinics where we are able to provide vaccines, also just educational seminars that they are able to tackle that misinformation and what's true and what is needed to hear, that's factual.
And so this has changed some since it was strictly COVID vax based at the beginning. How has that changed?
So as the contract progressed and we saw just amazing numbers on this contract, and then we started just kind of branching out to not just COVID vaccines, but the flu vaccine, the shingles vaccine, just lots of questions about vaccine. It's a hot topic in our culture right now. And so, and then just access to healthcare. Some people don't have transportation. They don't have internet in these rural communities. And so making appointments for them with finding specialists for whatever they need. We were able to offer, basically anything that they needed that would, that they maybe were just hesitant to reach out to their providers or didn't know how to reach out. And so that's how, it progressed as we went.
And you mentioned rural communities. That's been at the forefront of all of this. Has that been a challenge?
Again, due to the lack of, at times, transportation, due to the lack of internet access, everything we do in healthcare now is through a portal or through online. And so to find those resources for them and to sometimes we just need to be face to face instead of on a computer. And so that was probably one of the biggest challenges is just access. And then also the lack of knowledge that they were receiving, and they were getting their information from social media sometimes or from family members that maybe weren't getting exactly the truth on vaccines, and they were able to see that trusted person in their community and say, okay, I think they have some good information here. And of course, we were able to give them infographics regarding the vaccines, some frequently asked questions, answers for those, and just saw that trust build between the community health workers and the communities.
So tell me why community health workers are important.
Community health workers, as I said before, are a trusted, familiar face within the communities, but we're seeing just across healthcare in general how important community health workers can be within clinics and hospitals, even nonprofits. I currently went to a community health worker summit in Northwest Arkansas and heard so many stories of how helpful the community health workers were in different settings. And it's really, I feel like, the future of healthcare as far as, making those relationships and working with people that need just a little bit extra guidance. And we have a great organization in Arkansas. It's the Arkansas Community Health Worker Association, ARCHWA. And they are able to certify community health workers and get them out in the fields and where they need to go in their communities. And there's an upcoming conference for them. But community health workers really have just a heart for people. And so they're willing to do whatever they can to help the communities, whether it be in healthcare or not. The UAMS also has a certification program for community health workers. But we are seeing just how helpful and the positive influence that they have in different hospitals and clinics across the state.
And so aside from even the rural communities, we talk about minority groups specifically, as you mentioned earlier. Have you noticed that, Fernando, within the Hispanic community, even in Central Arkansas too?
Well, within the Hispanic community, the thing is, most of them, they don't speak English. So it was hard for them to get like a material in their Spanish language, so they can actually understand what's a myth, what's a fact. So AFMC and UMS help us, providing all those flyers, materials to them, so they can actually understand, and actually at the end they can make their own decision if they want to get vaccinated or not. So that was really helpful.
And it has made a difference. I mean, we're talking lots of events, vaccination events that have been held across the state for months at a time.
Right. Yeah, have been several partners on this grant with UAMS that we've worked with, and we were able to cover, the entire state and to offer these vaccines to the host state.
So you've made huge strides with the Mexican consulate and programs with them, vaccination events there. Tell me, though, about your work with the Arkansas Library System as well.
Well, we wanted to reach out to not only the Hispanics, but also, the African American and everybody who was hesitant to get the vaccine. So the Central Arkansas Library System gave us the opportunity to pretty much, help the community, across their libraries within, the Classic County.
And these events, they're still ongoing?
We are working, Arkansas Department of Health, they are working with AFMC to continue to provide these vaccine clinics. AFMC's been from the very beginning of vaccine availability, have been there for our communities before this contract even started. So back, in 2021 when the vaccine became available. But we go to anyone that will have us. So we've worked with churches, we've worked with local festivals, health fairs, job fairs. We even went to schools whenever school was starting in the summer. We've worked with public transportation areas where people, it's a high traffic area. So just anyone that would have us, really, we've been there. For the community health work contract, we worked very closely with our local pharmacies. And they would provide the actual vaccine and administer it, and we would be there on site to offer that education, to answer any questions, and then just to help, the actual clinic run smoothly. So AFMC's been a huge part of vaccinating Arkansas.
It really has, and what an incredible job that your teams have done. And Fernando, thank you particularly for the initiatives taken for minority communities and specifically within this part of the state. So thank you both so much. And that's it for this edition of AFMC TV. I'm Robin Ledbetter. Have a great day, and thanks for joining us.